All right. So I'm so excited for this virtual health talk. I know some people may end up joining live, but for everyone else, I am recording so you can watch it on your own time. My name is Dr. Lindsay Ogle. I'm a board certified family medicine and obesity medicine physician, and I see patients all throughout the state of Missouri to help them achieve and maintain their health through lifestyle optimization, weight management, and utilization of safe and effective medications. And one of my focuses is on that weight management. And so I wanted to do a talk on what is obesity medicine? What is weight management? What are the definitions? Why is it so hard to lose and maintain weight? And what are the treatment options? So we're going to go through all of that here today, and hopefully answer some questions that you have. All right, so this is just a quick overview of everything that I'm going to be talking about. This is the first time I am doing this talk, so if there are any lingering questions, please let me know, and I will go into anything in more detail if needed. Most of this information is coming from the Obesity Medicine Association, the OMA, and then the pictures are from the Obesity Action Coalition. So we're going to start with the definition of obesity. And obesity was actually just recognized as a chronic disease in 2013. So it is fairly recent that medical associations are even recognizing it as a condition to be treated. The World Health Organization has a great definition that's very simple. Obesity is an abnormal or excessive fat accumulation that presents a risk to health. And I think that's really important because we're always going back to, is this weight affecting somebody's health? If it's not, then that's okay. But we want to always focus on health and improve health related outcomes. The Obesity Medicine Association has a little bit more complex and nuanced definition, which I also think is helpful because it really highlights how complex weight management is. But obesity is a chronic, relapsing, multifactorial neurobehavioral disease wherein an increase in body fat promotes adipose tissue dysfunction and abnormal fat mass physical forces, resulting in adverse metabolic, biochemical, and psychosocial health consequences. So here we're going into more of a pragmatic definition of obesity. So this is what your doctor is going to actually be looking at if they are going to diagnose obesity. And classically, we use body mass index or BMI. And the reason that we use BMI is because it's very simple to use. It is very inexpensive, essentially free. All you need is a scale and a way to measure your height or know what your height is. And it's something that we can easily reproduce over time. If you were curious what your BMI is, all you have to do is Google BMI calculator. This one down here in the corner was from the CDC website, and you put in your height and your current weight, and then you just press calculate, and it'll give you a number. And then you can take that number and then look over here at the chart and see where you are classified. There's the underweight, normal, overweight, and then obesity categories. And those are broken up into class one, two, and three, depending on severity. And it is really important to know that BMI is not a perfect number to quantify somebody's health, especially where they're at in that moment. Because BMI does not take into account age or gender or sex. It does not take into account body composition, how much fat versus muscle somebody has. So it's really a great screening tool, but we need to have more information. And a way that we can do that is to actually measure your waist circumference. And that is done also pretty inexpensively. All you need is a tape measure, and you just put that tape measure around your waist, just right over your hip bones on either side near the belly button. Oftentimes it's a little bit above the belly button. You exhale, take a breath out, and then you pull on that tape measure around your waist, not too tight, not too loose, and then you take that measurement. And the nice thing about waist circumference is it actually does take into account whether you're a female or a male, and because our body compositions are different. So for females, the cutoff is 35 inches. Anything above is considered overweight or obese. And then for men, it's 40 inches. And so that is a really helpful way to give us more information than what the BMI will tell us. Another way to get more information about body composition is to do a body composition analysis. This is a little more technical and often more expensive. This can be done with body weight impedance devices or scales, DEXA scans. Um, and that's looking at how much body fat somebody has. And if you're able to do that, there's some cutoffs there in this chart, but most people do not get those numbers. BMI and waist circumference can give you a lot of information. So why is it so hard to lose and maintain our weight? We are taught that it is all about calories in versus calories out. So if that's the case, all we need to do is take in less calories and exercise more, and we'll lose weight. It sounds very simple, but in reality, that is not the case. Here are some incorrect assumptions about weight management. One is that calories in and calories out are all that matter. And a really good example that counteracts this is how your body responds to 100 calories of Twinkies versus 100 calories of broccoli. I think we all know that we feel a different level of fullness afterwards and satisfaction after those, and our energy levels are different too. Basal metabolic rate is stable throughout life. That is not the case. It definitely changes with age and our health status. And then we exert conscious control over the amount of calories we consume. If that was true, then if we eat more calories than our diet calls for, then we are at fault. But these are incorrect. What we do know about weight management is that calories in and calories out matter, but there are a lot of other factors. And that includes the type and timing of the food that we consume, as well as our hormone levels, whether we are healthy or ill at that time, what medications we're taking, how much sleep we have, many more factors. Basal metabolic rate is fluid. Um, this changes to maintain our weight set point, and I'm going to talk more about that in the next few slides. And then there are many factors that influence how many calories we consume. This includes the hunger and fullness signals that our body sends to our brain, the amount of sleep that we have, the volume of food. So I kind of mentioned that earlier. If you're having a candy bar versus a salad, it can have a similar amount of calories, but the candy bar is going to be really small in your stomach, whereas the salad's going to take up a lot of space and you're going to feel that fullness that's occupying your stomach. How much nutrients we've consumed. If we're low on a certain nutrient, our body's going to have more hunger signals because it's trying to trigger us to eat more so we can obtain that nutrient, our preferences and what we like in our foods, and then our socioeconomic factors. So, what can we afford? What foods are available to us? This may seem really complex and overwhelming, but it's actually a simplified version of what is happening for our metabolism and our hunger hormones and our fullness signals. And so there is constant regulation happening in our bodies, telling us when we are hungry, when we're full, and how much to eat or not to eat. And this the caricature that has the body is really talking more about those hunger and fullness signals. And so you can see that from the stomach and from the intestines and even our fat cells, they're sending up signals to the brain to tell us if we're hungry or if we're full. So that is happening on a constant basis. And then over here on the other cartoon, it's really telling a story about our metabolism regulation and when we have when our when we are losing weight, our metabolism actually goes up and vice versa. And I'm going to talk a little bit more about that. But there's a lot of feedback signals that are happening constantly in the background. So, understanding the complexity of weight management can help us explain why women have a harder time losing weight than men and why women carry weight differently than men. It also helps us to explain why weight becomes more difficult to manage as we get older. It's not just that we are less active as we age. It helps us to explain why medications alone can cause weight gain or weight loss without changing diet or exercise. It helps us to explain why weight plateaus occur when we're following a diet. And if calories in, calories out were the only thing that mattered, if we were to follow a low calorie diet over time, based on that logic, we would wither away to nothing. And of course, our body wants to protect against that. And so it is more our metabolism changes in response to that. And then it helps us to explain why weight management is not unique from other human physiology. Every aspect of our bodily system wants to stay in what we call homeostasis. It wants to stay in that perfect, healthy range where your body is functioning at an optimal level. We see this with our body temperature, with our blood sugar, with our electrolytes, and we see it with our weight as well. So that weight set point, the homeostasis of our body weight. A great analogy is our thermostat at home. Most of us like to keep our temperature at home around 70 degrees. And when it is cold outside, like it is in these winter months, then the heat will turn on and it'll keep us set at a comfortable, our home at a comfortable 70 degrees. Um, our body does the same thing. And so when we lose weight, our body actually sees that as a threat. It thinks that we are starving and that we are not going to have access to the calories and the nutrients that we need. Because that was a real threat many, many years ago. We did not have access to as much food as we do now. And so, to help protect us from famine, our body would turn its metabolism down when we were losing weight so that we would be able to maintain those energy stores for that time when food was not available. And we see this through scientific studies that when people lose, it's usually around 10 to 15% of their body weight, we see a drop in their metabolism greater than we would expect. And so that helps to explain why it is harder to maintain that weight once it is gone. And right now, we do not have any great treatments for this metabolic, we call it metabolic adaptation. So that metabolism decreasing, we don't have a great treatment to offset that. This is where exercise is so important for weight management, and I will talk more about that at the end. But the best defense for this change of metabolism is increasing physical activity. Another way weight set point presents itself is change in hunger and fullness signals. And so what we see is when we have lost weight, our hunger hormone, the main one is ghrelin, it actually increases, and we can measure this in human studies. And then our fullness signals, most popular and well known right now is the GLP-1, those go down with weight loss. And so what we see with weight loss overall is yeah, like I said, we'll talk about actually we'll talk about both the GLP-1 and ghrelin and how we have treatments to help offset those changes. So whereas the metabolism, we don't really have treatments other than exercise, but we do have treatments for both the ghrelin and the GLP-1 changes. Overall, this explains why it is so hard to lose and maintain weight once you have gained it, especially if it's been present over time. Because when you reduce your calories and you exercise more and you lose weight, your metabolism is going to decrease, your hunger hormones are going to go up, and your fullness hormones are going to go down. And this can sound really defeating. and frustrating. And this is why we often see yo-yo dieting, that loss and gain and loss and gain. And this is where working with an obesity trained physician can be so powerful because we have the tools to help offset some of these changes. Another thing that can make weight loss so difficult is the weight bias that we see in our society. We see it both um, implicitly and explicitly. If you Google obesity or you see ads about weight loss, you often see images like these where you don't see a full person. You just see their body and their excess weight. There's often a lot of association with junk food eating, as if people who have a quote unquote normal body weight do not eat junk food, which is not the case. We all do. Um, but they're really stigmatizing images. And so we're seeing this constantly. Um, it's external in our world around us, but it's also internal. And so over time, that really erodes people's self-esteem and it increases their stress levels. It can cause them to avoid to go to the doctor's office because there can be a lot of shame and stigma associated with going for medical care, with being weighed out in the hallways and needing a different blood pressure cuff. There are different things that can happen that can seem not a big deal, but over time can really, really lead to these poor outcomes. And they can lead to disordered eating and anxiety and depression. And these can all make weight management and health maintenance more difficult over time. And so I hope in this presentation you will notice that the photos that I have included are much more positive and are showing people who have excess weight living lives like we all do at work and with our families and exercising and eating foods. And so hopefully you notice the difference between these images and what are included in my presentation. All that being said, there are also several health conditions that are important to rule out with your doctor. And this also reminds me that something I should have said in the beginning. Although I am a physician, I am not your physician. All of this is health information for you to take, review, learn from, and then bring back to your doctor for specific advice for your health and your situation. But some things that you may want to talk to your doctor about are conditions like insulin resistance. This is very common with excess weight. And we see it in conditions like prediabetes, diabetes, and PCOS. But it can happen even before those even even before or without those other conditions. And insulin resistance can make it more difficult to lose weight. Hypothyroidism, low thyroid levels can make it harder to lose weight. Eating disorders, we want to make sure that these are screened for and treated appropriately. And they often get overlooked in people who carry excess weight. We tend to think of someone who has an eating disorder as being very, very small, but that is not the case. Binge eating disorder is extremely common, but also anorexia and bulimia occur in people of all body sizes. And medication side effects. So there are several medications that we know and prescribe on a regular basis that can lead to weight gain. And so it is worth talking to your doctor, especially if you notice if you started a medicine and started to gain weight after being put on that medicine, maybe talk to them about that association, and there may be other options that you can switch to. So let's get to treatment. So, what are the goals of treating obesity? We are treating excess weight so that we can treat and prevent weight-related medical conditions. Our goal is not for everyone to be at a normal body weight or fit into a certain size jeans. I know that that may be your goal at some point, but really from a obesity medicine and from a health standpoint, we are always thinking about health. And so that is why we are treating the excess weight. We are trying to focus as much as possible on non-scale wins. Examples of these include being able to play more with your grandchildren, Go to Disneyland and walk the park. Um, I've had patients who have been able to run a half marathon. It could be sitting on a airplane seat, having more energy to work throughout the day without a nap. Those sorts of things are really, really important. The lifestyle improvements. We see health benefits with weight loss of 5% or more. And that may seem like not a lot. So, for example, somebody who initially weighs 200 pounds, if they lose 10 pounds, then we will likely see health benefits. We see more benefits with more weight loss, but we start to see them at 5%. So that's a really, really great baseline goal for us to have. And I talked about this. Our goal is not to get everyone to the normal BMI. And I talked earlier about how BMI is not perfect, anyways. And really, our goal is to find a best weight range. And what I mean by that is what is a range of 5 to 10 pounds that you feel great at, and that your health is well controlled, and that you are doing things that you can maintain long term. If you have been able to get to a certain weight with an extreme diet or exercise plan, or on a medication or a treatment regimen that you do not tolerate, there's no point in that, because whatever we do to lose weight, you are going to have to continue to do to maintain that weight loss. And sometimes we have to do even more to maintain it. And so we want something that is sustainable long term. Obesity and weight management is a chronic disease and treatment, and requires chronic treatment. And so we're looking for lasting results here. And everybody fluctuates in their weight. It is very normal. There are changes in our fluid status. Are we dehydrated, or did we drink a lot of water? Are we constipated? Did we travel recently? Are we sick? For women, are you at a certain phase in your cycle? Weight's going to fluctuate. That's okay. What we're looking at is more of an average over a week or so, and we want that to stay in a normal, or stay at your best weight. All right, so these are the four pillars of treatment for obesity medicine from the Obesity Medicine Association. So we talk about nutrition therapy, physical activity, behavior modification, and medical interventions. And medical interventions include medication and surgery. And so we want to touch on all of these for all patients. Um, Even if we are utilizing a medication or a surgery, we don't do that and then ignore the other three pillars. We are wanting to touch on all of these for everybody for optimal health. We'll go through a little nutrition 101. Again, these are um, kind of broad recommendations that I think will be beneficial for everybody. But working with a dietitian can be extremely beneficial. So, especially if you have this as a insurance benefit. But even if not, it could be worthwhile the investment to work with a dietitian, even for a short period of time, get some education and some pointers about how to optimize your nutrition. So fiber, super important. Fiber is a carbohydrate, but it's I would say, the most important one to focus on. Um, Having fiber helps you increase your fullness. So you will feel fuller faster and for a longer period of time if you have fiber. It helps also to lower your blood sugar and your cholesterol. So again, going back to our whole goal with weight management is to improve health. Adding, Increasing your fiber is a great way to do that. It helps improve our gut microbiome. Typical goal for women is about 25 grams a day, and for men, 30 grams a day. And I recommend, for all of these points that I'm going to talk about, doing a nutrition audit is what we call it, and monitor your intake of your food over a few days. 3 days to a week would be plenty. You can use an app like MyFitnessPal and just write down in that app everything that you are eating during that time frame, and it will tell you how much fiber that you're having per day. If you are doing that and you see you're having 10 grams of fiber, I recommend increasing slowly. Because if you go from 10 to 20, it's going to upset your stomach because of all of these changes. And so you want to increase by maybe 5 grams a week and making sure that you're tolerating that well until we get to your goal. For increasing fiber, there are lots of things that you can do. A simple Google search for high fiber foods, taking a look and finding something that you enjoy eating and adding that into your routine will be very beneficial. Sugar is also a carbohydrate. This is another really important one, but we want to limit it as much as possible, especially added sugars. And by no means do you have to eliminate sugar from your diet. We do not want to do anything extreme, like I mentioned before, but just start looking at nutrition labels and opt for options that have lower amounts of added sugar or none, if possible. Protein. Oh, and I will say for the sugar, the reason that we want to limit it is because it really does not give us a lot of nutrition benefit, and it's high calories. And then it also raises up insulin levels, which insulin was listed before, and we may or may not have time to talk about it more later, but high insulin levels make it harder to lose weight. And so if you're constantly eating added sugars, then it's going to be harder to lose weight. So that's a little bit of information about sugar and insulin. As far as protein goes, this is another one that it would be really helpful to do that nutrition audit and see where you're at. Adding more protein will help you feel more full, like the fiber does. It also helps preserve muscle mass, helps us stay strong and active as we get older. It's very, very important. And especially if you are on a weight loss journey, we want to preserve the muscle mass that you have. And the only way to do that is to make sure you're getting enough protein and making sure that you're exercising, which we're going to talk about on the next slide. The amount of protein that is recommended can vary from person to person, which is another reason why either talking with your doctor or a dietitian can be so helpful. But on average, most of my patients, I would recommend to take to have at least 1 to 2 grams of protein per kilogram of body weight. So what you would do would be most of us weigh ourselves in pounds, or we know how much we weigh in pounds. So just again, use Google and put in 200 pounds equals how many kilograms it'll tell you. And then that would be your minimum of, um, of grams of protein per day. Times it by two, and that would be a kind of an upper limit. And same thing, you want to slowly increase this over time, so it doesn't upset your stomach. That's I don't typically talk a lot about fats for my patients. Most of us get enough. There is not necessarily a reason to avoid fats altogether. We need fats in our diet. And so usually this comes with our protein and our other sources of nutrition, but we want to avoid trans fats for our health. That is very, very clear. Very, very clear for our health. And then water, super important. Always want to keep water nearby. Want to make sure that you're well hydrated. Sometimes our body gets confused if we're thirsty. It may think that we're hungry. And so oftentimes we're really just dehydrated. And then hydration is another really important thing with our medication. So we'll go over that later. If you don't like water, you can do flavored waters. Just make sure you're doing sugar-free options, or you can naturally flavor it with cucumbers or berries or anything mint, anything like that. Some people benefit from an electrolyte to drink. So those are just the packets. Again, look for sugar-free that you add to the water, and that can give you some more electrolytes and can help with hydration. Usually a one a day max is plenty for that. If you're looking for a particular diet to follow, the diet that has the most evidence for health is the Mediterranean diet. This is not necessarily a weight loss diet, but it is a healthy diet. So that is something to look at and just kind of get an idea of some of the foods to incorporate. If we're looking for low calorie diets so we can aid in weight loss, I would not go lower than 1,000 calories for women and 12,000 or sorry, 1,200 calories for men per day. Lower than that, it's going to negatively impact your metabolism, and you're probably going to feel pretty crummy. All right, physical activity. Most of us are not physically active enough, and this has a lot to do with school and work in our modern age. We sit a lot at our desks. So we have to be very cognizant and proactive about getting our physical activity in. This is true for people of all body sizes. We all need to be more active. Exercise is very unlikely to lead to weight loss, but exercise is extremely important for weight management, as I mentioned before. Um, it is also extremely important for our health, our cardiovascular system, so our heart health. It also helps us to build that muscle mass. It helps us to be flexible, and it helps us to just be active and engaged in our lives around us. Also, extremely helpful for mental health. I have many patients whose anxiety and depression are improved with exercise, and it can help with sleep too. So many benefits. Weight loss is probably not one of them, but that's okay because we're focusing on overall health. Some is better than none. So start where you're at and you can increase. And that can be as little as 5 minutes, 3 days a week. Never tell yourself that it's not enough. You want to build it in the habit and the routine. And then you're able to identify yourself as somebody who exercises. And then you're going to be able to build off of that. And over time, you're going to be really impressed about how far you've come. So start small and slowly work your way up. And find something that you enjoy. If you love biking, go for a bike ride. If you do not like it at all, I mean, you prefer a class, you can join a class. There are so many options available. Our goal for everybody for health is 150 minutes per week. Now, if you're doing a really intense exercise, it can be reduced to 75 minutes, but a good goal is 150 per week. If you are very busy, long work days, or have, lots of kids at home, you're not able to do dedicated exercise, then getting at least 5,000 steps a day is an equivalent to this. So that is another alternative to dedicated exercise. And then we see even greater benefits up to 300 minutes a week. I'm sorry, or 10,000 steps a day. So we're all working towards those goals, no matter where we are on our health journey. And walking counts. Walking definitely counts as exercise. So make sure you factor that in. Ideally, we're doing 2 days of resistance training per week. And two apps I would love to share with you. I'm sure you've heard of Peloton. I am late to the game. I just downloaded it a week or so ago, but loving it so far. It is so easy to search for a 20-minute body weight exercise, and they'll walk you through everything in the comfort of your own home, show you exactly how to do it. They're so positive. Highly recommend. There's also a wonderful app and website, GLP Strong, that one of my mentors created specifically for people who are on GLP-1s and are wanting to get in the recommended 20 minutes 2 times a week. And that's how it's built. And it's built for beginners. So that is available as well. Behavior is our third pillar. So we're thinking about stress management. What do you do for stress relief at the end of the day? It could be your exercise. I put Peloton on here also because they also do guided meditations. A lot of people like the Calm app, so that's another option. And then YouTube is available for free meditations, calming music. Or dance music, and you can dance to release your stress that way. um, Playing with kids or with yourself or being a part of a team, um, a team activity, a pickleball, other sports like that. Art is a great way to be creative and release stress as well. And then based on whether you're an introvert or an extrovert, whether spending time alone or spending time with others, very, very helpful. And we all are social creatures and do benefit from that social interaction. Mental health. So if you're struggling with any of this, with anything, and really we all could benefit from some counseling, psychologytoday.com is a wonderful resource to search for a counselor in your area or that accepts telehealth. And you can read about them, read the reviews, see what insurance they accept, and schedule appointments with them. So I highly recommend psychologytoday.com. Disordered eating. So this is something that we always want to be um, cognizant of and making sure that we're not missing this because it has to be addressed before we use medications or surgery for weight management. And sleep. Um, a lot of us do not get enough sleep for lots of reasons. The stress and mental health not being managed, and then just our busy lives that we have. We want to really focus on what we call sleep hygiene. So again, you can Google that and you can see everything about sleep hygiene. And I actually have a YouTube video where I talk all about sleep hygiene and what all of those steps are. But there's also a free app, CBTI Coach, and they will also talk to you about sleep hygiene and give some feedback and education about sleep health. All right, so on to medication management. The indications for using medication for weight management and obesity is anyone with a BMI of 30 or greater, or a BMI of 27 or greater with a weight-related condition. And examples of those are diabetes, high blood pressure, abnormal cholesterol, obstructive sleep apnea, and there's many more. So talk to your doctor if you think you may qualify. It's really important to know that the recommendation is to continue treatment with the medication or whatever you're doing, even if your BMI goes below that cutoff, because obesity is a chronic condition. And a very good example is if somebody has high blood pressure and we need to start them on a medication, we continue that medication even when their blood pressure is within a normal range, because we would expect if we stop the blood pressure medicine, their blood pressure is going to go back up to that higher number. And so we want to continue the medication. Same thing for weight management. And it's also really important to know that just because you qualify for a medication from a medical standpoint does not mean that your insurance is going to cover it, which is very frustrating and confusing and quite frankly unfair. There are many people who are working to correct this and doing a lot of advocacy work. But these are the medical indications. Again, does not mean that your insurance is going to cover it. And that could be something that you want to talk to your insurance provider or your human resources department about maybe expanding that and including that coverage. I'm going to go through a couple of the medication options. Phentermine is one of our oldest medication options that have been available since 1959. And so we have 66 years of use of this medication. We know that it is safe. We know that it is effective. It helps suppress the appetite. It's one pill in the morning, very easy to use. Also very affordable, typically less than $20 a month, even without insurance coverage. So this is a great option if your insurance does not cover medications because you can easily afford it without that coverage. The cons to this medication, it's a controlled substance, and so it is monitored a little bit more closely. It's a stimulant medication, but I always say it's more closely related to, its effects are more closely related to caffeine from a stimulant standpoint compared to medications like Adderall. You don't really see people selling phentermine on the streets. It's not something that we're worried about addiction for. Most common side effect is dry mouth. It can also cause nervousness, increased heart rate or blood pressure, constipation, trouble sleeping, all of that stimulant, caffeine-like side effect potential. Reasons why we can't prescribe it are really high blood pressure that's not controlled. But if you are on a blood pressure medicine and your blood pressure's in a good range, it should be safe to take. Of course, your doctor will help decide that. If you've recently had a heart attack or a heart procedure, probably not a good option. Um, if you have glaucoma or if you have really high thyroid levels, not a good idea to take this medication. Fusimia is essentially like the next generation because it is a combination of phentermine and topiramate. This is also an appetite suppressant, and it comes as a brand name, which you can get coupons for and get it as low as about $75 a month. So more expensive, but still more reasonable than most of our newer medications. But I often prescribe just the generic separately, and then I have my patients take those two medications combined and kind of do an off-label combination. So that's available. The benefits are that it can also help reduce soda or pop cravings because it affects the way carbonation tastes. And so, if you really struggle with cutting back on your soda intake, this medication may be helpful. Topiramate is also used for migraine prevention. It can help with insomnia. It can help decrease alcohol cravings. It can help with tremors. It can help with mood. It can help prevent seizures. And so it can be a really great choice if you have any of these other concerns because it can help manage both of those things. It has everything that is the same as far as cons for phentermine, but it also has a couple other ones because of the topiramate. And the most important one is that it can be associated with birth defects, specifically cleft palate. And so any woman who has the potential to become pregnant needs to be on a reliable birth control like an IUD or another form of birth control that is appropriate for her to help prevent that possible complication. It also can increase risk of kidney stones, some potentially eye vision change problems, not very common and reversible, thankfully. Numbness and tingling, also reversible. And some people feel a little cloudy on the medication, also reversible. Contrave. This really helps with cravings and people who really think about food a lot. So what it does is it helps break the reward pathway that a food has in the brain. Naltrexone, it's a combination of two medicines, naltrexone and bupropion. Naltrexone is used to treat alcohol and opioid use disorder. It is a anti-opioid. It is not an opioid. It actually blocks the opioid receptors. Um, so it blocks that reward pathway. The bupropion we use for a lot of different things. The brand name is Wellbutrin. We use it to help with mood and depression. It's a non-stimulant ADHD medication, so it can help with focus. We use it to help people cut back on their cigarette smoking. So it can really help with a lot of other conditions or concerns that somebody might be having, which can make it a very great option. The brand name is available for $99 a month with a coupon, or we can do that off-label of prescribing the individual medications as their generic forms, and then having you take both of them together. And it's not a controlled substance, which is a benefit. Common side effects, nausea is most common, typically related to the naltrexone. Some people feel a little dizzy, headache, can have anxiety, restlessness, affect sleep. Those are tend to be more related to the bupropion, and they're typically only happen in the beginning and get better with time. If you have a history of a seizure or you are actively using opioids, you cannot take this medication. And all medications, I talked about Qsymia, we can't get pregnant on, but any medication for weight management is not recommended during pregnancy. All right, so now we're getting to our GLP-1 agonist, which is what um, has really gotten obesity medicine very popular recently. And I think For good reason. I mean, they're very, very effective medications, and we'll go into to why that is. Um, but they help with weight management by addressing three concerns or three parts of the weight management pathway. One is that they stabilize sugar and insulin levels. And I mentioned earlier when I was talking about nutrition about reducing added sugar and how that how higher amounts of added sugar can lead to higher insulin levels, which can then prevent weight loss. This is helping to do the opposite. So it's helping to keep those insulin levels a more stable, controlled level and will help the body release the excess weight that way. And it also helps with cravings because when our blood sugar levels are high and then drop, we don't feel well and we're craving, more sugar or more food to help bring those blood sugar levels back to a normal range. They also help tell your brain that you're full. So it let's see here. Yes. So we talked about the GLP-1 levels going down with weight loss. So this helps to augment those GLP-1 levels. It's turning them up to a higher level. So it is helping to um, turn on the fullness feeling in our brain. And it also slows the GI tract. And so that helps us to feel full sooner and for a longer period of time. Common side effects from GLP-1 agonists are related to the slowing of the GI tract and are typically occur when we start the medication and as we increase the dose. For the vast majority of my patients, their side effects are mild and temporary, and there are several things that we can do to offset them. If anybody, number one, will slow down titration. So if anybody is having, ongoing side effects, it's happening every day, they're needing to take nausea medicine on a regular basis, we need to slow down or take a break from the medication. So that is always okay. We can slow down and do what's best for you in that moment. Ensure adequate hydration. So I talked about this with the nutrition. Dehydration is going to it's going to make us feel crappy. We're going to feel nauseous and lightheaded and fatigued. And as I also talked about how dehydration can be confused with hunger, we kind of get the same thing when we're on these medications that we can they'll block the hunger signals. But they can also block the thirst signals. And so people tend to drink less water. So making sure you're drinking lots of water, especially before, during, and after your injection. I often recommend patients who are on GLP-1 agonists to once a day drink an electrolyte drink to help with that hydration. We want to eat small, frequent meals, at least 3 meals a day. We want to avoid an empty stomach. The empty stomach can really cause nausea, so we want to avoid that as much as possible. And the appetite suppression for some people can be quite powerful, and they can easily skip breakfast, sometimes even lunch. We don't want to do that. We want to eat our at least 3 small meals throughout the day. We can prescribe nausea medicine as needed, but again, if you're needing that every day, then either this is not the medicine for you or we need to adjust your dose. Along those lines, we may consider changing the medication. And I will say tirzepatide, the brand name is Zepbound, is usually is tolerated better than semaglutide, which the brand name is Wegovy. More rare side effects include acute pancreatitis or cholecystitis, which are gallbladder concerns. We really see this with any significant weight loss, so it's not really specific to the GLP-1 agonist. Um, it's just the fact that these medications are so effective at helping with weight loss that patients lose a significant amount of weight and it can lead to gallbladder disease. A reason we will not prescribe the medication is a personal or family history of medullary thyroid cancer or multiple endocrine neoplasia syndrome type 2 or MEN2. These are fairly rare conditions, but there have been association with increased cancer risk in our animal studies. And so we avoid these completely if somebody has a personal or family history of these conditions. Again, it's medullary thyroid cancer. If it's other types of thyroid cancer, talk to your doctor. You may still be able to take the medication. If you have low or high thyroid levels, if you have a condition like that, you can still take the medication. We're worried about medullary thyroid cancer. All right, so there are three GLP-1 agonists that are FDA approved for weight management. Saxenda or liraglutide, I didn't even mention that earlier because it's not used as often. It's kind of our first generation of our GLP-1 for weight management. It's a daily injection. 63% of patients lost at least 5% of their body weight. And going back to the very beginning of this talk, when we were reviewing that 5% body weight can lead to health benefits, we use that 5% body weight loss as a marker of whether the medication is beneficial or not. So we have that goal. 63% of patients reached it, but only 14% of patients lost 15% of their body weight. Wegovy or semaglutide. This is a weekly injection. 90% of patients lost 5% of their body weight. So a huge improvement. Almost everybody, 9 out of 10, reached that health goal. And then 35% of patients were able to lose 20% or more of their body weight. So over a third are able to lose 20% of their body weight, which is substantial and really, really wonderful. So for example, going back to that 200-pound person, that would be 40 pounds of body weight. And Zepbound, tirzepatide, this is also a weekly injection. This is the next generation, the newest medication that we have. This is both a GLP-1 and a GIP, which is another one of those gut hormones that help with appetite regulation. And this is similarly, 90% of patients are able to lose 5% of their body weight, but 50% of patients are able to lose 20% of their body weight or more. Results vary with all of these treatments, but to me, that's pretty incredible. And again, like I said, it's even tolerated better, the Zepbound is compared to the Wegovy. So really, really exciting. And there are creating more and more medication options. I will briefly talk about surgery. So indications for surgery, a BMI of 40 or above, or 30 with type 2 diabetes, or 30 if somebody has not been able to lose a significant amount of weight that has led to health improvements, or they have not been able to maintain that weight loss with medication management. So here are a couple of contraindications, and if you were considering surgery, your surgeon would go over this with you. I think one important one to highlight is the pregnancy or planned pregnancy within the next 2 years. We really want to give your body at least 2 years to recover before you carry a pregnancy to ensure the chances of a healthy pregnancy. So something that's really important to be aware of. And having surgery is a lifelong commitment. So it's really important to talk to your team about what that will look like. So the sleeve gastrectomy, unfortunately, this the hormone picture went over the anatomy picture, but that's okay. Sleeve gastrectomy is the most commonly performed surgery, bariatric surgery. It removes a small portion of the stomach, which helps not only with portion control, but that part of the stomach is what releases ghrelin, which is our hunger hormone. So with that gone, hunger signals go down dramatically. And so we talked earlier about hunger hormones increasing with weight loss. Well, this will help lower those hunger levels. And so it's very, very beneficial to have that those lower hunger levels when we are following lower calorie diets and having that weight loss. Less likely to cause deficiencies in nutrients, but it may worsen acid reflux or GERD. Gastric bypass, this is a little bit more involved. It creates a small stomach pouch and then it bypasses the rest of the stomach and most of the intestines and connects at a lower level. And it helps us to decrease the amount of calories that are absorbed, but it also really impacts the gut hormones that are released, similar to how our new GLP-1 medications function. And we're really realizing that that is what is having such a substantial impact rather than the malabsorption. It's those changes in the gut hormones. It's the most effective for weight loss and at improving metabolic conditions like type 2 diabetes and less likely to cause GERD or acid reflux. It has that increased risk of malabsorption. Weight maintenance. So this can be some of the trickier parts. Weight loss is exciting. You're getting a lot of, people are noticing. You're getting a lot of compliments. Your doctor is telling you your blood pressure is better, your blood sugar is down, your cholesterol looks better. You can take off these other medications. You're feeling great. It's the weight loss is exciting. The weight maintenance is boring. And that is one of the reasons why it's harder. In addition to those metabolic changes that I talked about before. Um, but we do have the National Weight Control Registry, which is a collection of thousands of patients who have lost at least 30 pounds or more and have kept it off for at least a year or more. And what we've learned from them is that most of them eat breakfast every day. Most of them weigh themselves at least once a week. Most watch less than 10 hours of TV per week. Almost everybody exercises on average 1 hour a day. And most maintain a consistent eating pattern throughout the whole week. So they're eating the same on the weekdays as they do on the weekends. And then if they have been able to maintain that weight loss for 2 years, then their risk of weight regain is reduced by about 50%. And so this does not mean you have to necessarily do all of these things. This is just going to increase your chance at maintaining that weight loss. And so the one that I would really focus on is the exercise. As we talked about earlier, that's the best way to offset the metabolic adaptation, the slowing of the metabolism. And then monitoring some form or monitoring your progress in some way, whether that's weighing yourself or just noticing how you feel in your clothes. And most people do eat breakfast every day, so something to consider adding that into your routine. So, summary, obesity is a disease, not a moral failing. Treating obesity can help treat and prevent many chronic medical conditions. When used appropriately, treatments are safe and highly effective. And treatment for obesity has to be long term. Thank you for listening. I hope this was really helpful for you. Again, if you have any questions, you can comment below once this is on YouTube, and I would be happy to go into further detail. You can follow me on Instagram, TikTok, subscribe on YouTube. You can message me through those portals. I'm also available on my website, MissouriMetabolicHealth.com. There is a way that you can contact me directly on there. And if you would like to be a patient of mine, I am accepting new patients. You just have to be 18 years or older and in the state of Missouri. For me to be able to see you. These are just my references. But thank you again, and I look forward to more talks in the future.